Every story has an author. Every author has a story. Join us for off-the-page interviews, inside stories, and a look into the world of publishing. This is PageTurners. Welcome to PageTurners, presented by the agency at Brown Books. I'm Hillary Kennedy. Fertility physician and patient Dr. Noorhasan shared last time about her new biography, Miracle Baby, a fertility doctor's fight for motherhood. And she's back today to talk about her follow-up book, The Fertility Manual, Reproductive Options for Your Family. Welcome back to the show.
Thank you for having me again, Hillary.
Okay, so how important is making infertility a conversation that we have and making it less taboo?
Oh, you know, infertility affects 1 in 8 couples. And when you think about that, that's a lot of people. And so we all know someone who's struggling with infertility. And the real way to make it less taboo is to just talk about it, to share your experiences, because your experience can help someone else. And also, sometimes by opening up and sharing your experience allows another person who may not have felt comfortable talking about their story feel comfortable sharing their story.
Right, the more we talk about it, the more we can find solutions and comfort and inspiration, all of those things. So tell us about the Fertility Manual, Reproductive Options for Your Family.
Yeah, so when I wrote this book, I've noticed over the last many years when patients come in to see us, it's a very awkward, strange, abstract world for them. Here they are, they're sitting with the doctor, the clinical staff, and describing details of how they're trying to conceive and why things aren't going right. Mm-hmm. And it's very difficult for them. And so I wanted to write a book that gave patients an understanding of the terminology that we use, some of the testing. Why do we do all the testing? Because they come in and they see us and we put them through a series of testing. And why do we need to do all these testing? And then also an understanding of the different treatment options that are available. And so I didn't want to write a 1,000-page manual that sat on a desk and accumulated dust. I wanted to write a short, nice, concise book that will equip patients with the knowledge they need to walk into the doctor's office and be confident in terms of what questions to ask and how to go about making the right decision for their treatment options.
Right, it's so nice to walk into that situation feeling a little more prepared for what you're entering into. Yeah. Well, what are the leading causes of infertility?
You know, a lot of the bigger causes of infertility that I see right now today, a lot of it's age-related. And so we're all waiting later in life to conceive, pursuing our careers, traveling the world. And then when it's finally time to have a baby, we're so much older. So a lot of it's age-related. Additionally, we see a lot of second and maybe even third marriages in people who've had prior tubal ligations and prior vasectomies. And so those patients also need help conceiving, even though they didn't need help in the past. Mm-hmm. And then there's certainly some contribution in terms of our exposure to potential toxic substances. So for a lot of these reasons, we see a lot of patients now with infertility.
So in your manual, you discuss the variety of treatment options that are available today. So will you touch on some of those for us?
So one of the most simplest forms of treatment is just taking a pill. And so there are pills like clomiphene citrate or letrozole, and these are pills that women can take to help them ovulate or release the egg. And you can time the ovulation with either telling them to have intercourse at a specific time or timing it with what's called an intrauterine insemination, so IUI. Intrauterine insemination means we would put the sperm sample directly into the uterus, and that increases the pregnancy rate because with an intrauterine insemination, there's now a shorter distance for the sperm to swim to the egg, from the uterus to the egg, than from the vagina to the egg. And also, by putting the sperm directly into the uterus, we've bypassed the cervical mucus, where many times the sperm can get trapped there. Now, in addition to taking pills to ovulate, there are injectable medications we can also give patients that can help them produce eggs and ovulate. And similarly, you time that with either intercourse or with insemination. Now, whether it's pills, injections, timed intercourse, intrauterine insemination, all those methods of treatment, the fertilization or conception occurs within the woman's body. Now, in vitro fertilization, IVF, the fertilization occurs outside the woman's body. So we get the eggs, we get the sperm, we create the embryos in the lab, and then we grow the embryos out for several days. Now, in today's day and age in the United States, we do what's called frozen embryo transfers. We're seeing higher pregnancy success rates by freezing the embryos, allowing the woman's body to take some rest and reset after the retrieval, and then doing a subsequent transfer a couple months later. Additionally, with the frozen embryo transfer, we can test the embryos for certain genetic abnormalities. So that's called pre-implantation genetic testing. And the most common version of that is what is called aneuploidy screening. So aneuploidy is when an embryo does not have the right number of chromosomes or the right number of gene regions. And so aneuploid embryos are at high risk for miscarriage or even failing to conceive. So by testing embryos for aneuploidy, we can transfer the non-aneuploid embryos to a woman's uterus, and therefore increasing her chances of conceiving and decreasing her chances of a miscarriage. Another type of genetic testing that we can do with the embryos is testing for certain specific genetic disorders. So, for example, there are certain genetic disorders that are very common in our population. These are autosomal recessive disorders. So, for example, one of these is cystic fibrosis, which can affect the lungs, sickle cell, which can cause a lot of anemia. And so certain patients can carry the gene, or sometimes you hear people say they have the trait, but don't have the actual disease. It only becomes a problem when two people who carry the gene for the same disorder get together. Now there's a higher chance of having a child with the actual full-blown disease because now they have abnormal genes from both sides. And so with the genetic testing, you can screen the embryos and determine which one carried the genes and transfer the ones that do not carry the genes, or at least just carry the trait but not the full-blown disease, that don't have both copies of the same gene. Another type of genetic testing that you can do with this is testing for certain genes that cause cancer. Wow. So for example, the BRCA gene causes breast and ovarian cancer. So if we know BRCA gene runs in a specific family, we can test that family's embryos for the BRCA gene and then transfer the embryos that do not carry the gene, and therefore increasing the lifespan of that soon-to-be child's life, so they're not suffering from cancer. So it allows us to do a lot of testing to help patients with the genetic testing. In addition to helping patients conceive with all those different types of technologies I just described, today now we're getting better at fertility preservation. So for decades, we could freeze and store sperm. We could freeze and store embryos. But now, only in the last several years, we can actually freeze and store eggs. So in the past, women used to have to choose, do I get married and have children early on? Do I pursue my career or go travel the world and then maybe have a family later? And with fertility preservation, women can freeze their eggs when they're younger, and then they're there, the eggs are there if they should ever need them in the future. So the technology has grown significantly in the last several decades.
Oh, that's incredible.
Yeah.
That's absolutely incredible. And just the options that are available now, it's mind-blowing to me. So you talked about the pre-implantation genetic testing. What's kind of some of the concerns with designer babies? That's a term that we hear a lot. There's a lot of media stories about that. So tell me your thoughts on that.
Absolutely. Like I mentioned, the genetic testing is for aneuploid screening to decrease miscarriages and improve a woman's chances of conceiving. We also use it to prevent passing on certain genetic disorders to the next generation, particularly the autosomal recessive disorders like cystic fibrosis and sickle cell. And certainly it's very helpful, to prevent cancer in the next generation. The technology is not meant to be used to have a baby with the right hair color or eye color. The technology is meant to help people conceive and also give them a healthy child.
Right, produce a better quality of life. Well, so what are some of the biggest struggles that couples face when they're dealing with infertility?
Well, one of the biggest struggles they face is the psychosocial dynamics. So they come into the office and they're trying to conceive, and it's a very difficult process for them. Women may feel less desirable because they're not conceiving. Men may feel less potent because they're not helping their wives conceive. And so that can really influence the dynamics of the relationship. And many times, when couples struggle with day-to-day living, they rely on family and friends to help them. But infertility is such an intimate topic that, couples are not sharing it with family and friends, and rightfully so in many ways. And so the support network that they would have had for other problems, they don't have for infertility. So one of the biggest struggles that they face is the psychosocial dynamics. Another thing that they struggle with is finances. Some insurance companies cover fertility treatments, but most don't. And unfortunately, a lot of the reagents and technologies that we use to help people get pregnant are very expensive. And so people have to pay out of pocket for this. And so it is difficult enough having to deal with the diagnosis of infertility, but then to have to deal with the finances on top of that can make it very difficult for patients.
That definitely would affect your mental health, I would think, just going through all of these things, these worries and these fears and the unknown. So how does mental health play a role in fertility?
The psychological disorders like anxiety and depression are intertwined with infertility so deeply that it's hard to separate them. And it becomes this vicious cycle. You have a negative pregnancy test, you get anxious and depressed about it, and that ruins your physical state, so that you do terrible with the next cycle and don't get pregnant, and then you get more depressed, and it just keeps going on, and so it makes it very difficult for patients. The biggest thing I would advise patients is to see a mental health provider. A lot of patients would love to have counseling. And one of the other very big tools that's very helpful is joining support groups. It's very helpful to know that there are other people out there who cannot conceive, that are struggling with the same problems. And so just knowing that there are other people out there makes things easier.
Right, nice to know that you're not alone in that. So you help a wide array of people conceive. Talk about some of the diversity of people you help in your practice.
Infertility knows no barriers. Anyone can be affected by infertility, regardless of race, religion, ethnic origin, socioeconomic status, or sexual orientation. And so it is my job to help people struggling with infertility.
Well, what advice would you give men and women who are currently struggling with infertility?
The biggest advice that I would give men and women struggling with infertility, and the take-home message I'm going to leave you with today, is that if you're struggling with infertility, go see a doctor, get a diagnosis, figure out why you're not conceiving, and then join support groups. Know that you're not alone in this process, and that parenthood is a real possibility.
Oh, I love that. It's a great message of hope to end on. This is such a great topic. Thank you so much. And the first book is Miracle Baby, A Fertility Doctor's Fight for Motherhood. And then the follow-up manual is Fertility Manual, Reproductive Options for Your Family. Thank you so much for being here. This gives a lot of people a lot of hope for their journey. This has been great.
Thank you, Hillary.
And please join us next time on the next episode of Page Turners.